From start to finish, vaccine development is a lengthy process. In tonight's Wear the Gown, Eyewitness News reporter Jeremy Baker finds out just how long it normally takes to get a vaccine and the reasons why a coronavirus vaccine may come much faster than normal.
When people talk about trials for vaccines, there are generally three phases. Phase 1 studies are usually very small, using about 20 to 50 people.
You give different doses of either a vaccine or medication to make sure that it's safe, that people don't have a lot of side effects, and at what dose you start to see some of those side effects, that you have a good idea of what dose is safe to take.
Dr. Jason Bowling with University Health System says Phase 2 studies uses a larger number of people, about a few hundred.
You give them the vaccine, and then you look to see how effective is the vaccine or the medication. And again, you're studying that safety signal. Are they having any side effects?
Phase 3 studies are the longest, using one group of people who get the actual vaccine and comparing it to another group getting a placebo and looking at the side effects in both.
That's where we have the highest number of people that we're studying with a vaccine to make sure that, again, that it's effective, but also that it's safe.
And the last thing you want to do is rush vaccine development.
If we don't take the normal process of going through these Phase 1 through Phase 3 trials, what you worry about is that you may have something that looks good in a lab experiment, but you're not sure how effective it is in people.
But because of the pandemic's global scale, vaccine developers have started producing before the trials are even over.
They're producing vaccine right now, so that if the data comes out from the trial showing it's effective and safe, there'll be vaccine product available.
For the 1918 flu pandemic, there wasn't a vaccine for 15 years, and groups that continued to have mass gatherings had higher numbers of deaths. That's why even when we do get a vaccine, likely at the beginning of 2021, we'll still have to keep wearing masks and socially distancing for several months after. Jeremy Baker, KENS 5 Eyewitness News.
For more information about family health, call 210-358-3045. You can also find the rest of the Wear the Gown stories. Just go to wearthegown.com.